Hi, everyone. It's Will from the Anastasia Island branch, and I'm here with Milva, who is the program manager for the North Central chapter of the Alzheimer's Association. So, good morning, almost afternoon, but still morning.
Still morning. Good morning
Yeah.
to you.
So, I just wanted to give you the opportunity to highlight what your organization does.
Sure. Well, I appreciate it. And as you said, my name is Milva Ballester. I'm the programs manager for the Alzheimer's Association's North Florida area, and I'm actually based in Jacksonville, but I do cover about 9 counties surrounding Jacksonville, which includes St. John's. And really, I wanted to just share with you what it is that the Alzheimer's Association is doing, and also more on the program side to give you an idea of the resources and support that we have available to really anyone who is affected, not only with Alzheimer's, but any related dementias as well. So I did mention that we are a chapter, so there are multiple locations throughout the nation. In our chapter here, we actually have one in Jacksonville, in Longwood, and in Pensacola. I might be missing a few there. But basically what the Alzheimer's Association does, it works together in 3 arms. So we have the research, which many of you may be aware of. We have the advocacy side, and then we have the program side. And for programs, we really do offer quite a bit of support and resources to anyone affected. And to go over a few of those with you, I'll start off with our 24/7 helpline. And that number is 800-272-3900. But it is available at any time, of course, any day, for whatever reason you really need it for. If you're a caregiver and you're having difficulty perhaps with the behavior of your loved one, you can call the helpline and they will help you navigate through that. If you're interested in just attending a support group or looking for a support group in your area, the helpline can also assist you with that. The great thing about this resource is that, like I said, it's available 24/7, but who you are speaking to, these are master's levels clinicians that are trained with Alzheimer's and dementia. So you're getting quality information and assistance. So that's really a fantastic resource for anyone. And that's 24/7 helpline, that 800-272-3900. And then the second main resource is our website. And our website is actually pretty simple to remember. It's alz.org. So alz.org, Alzheimer's, ALZ for short. And I like to say that you could be there for quite some time, perhaps the rest of the year, and find something new every single day. You have a wealth of information available at your hands. And again, this is for caregivers, for those affected with the disease as well, for students who want to learn a little bit more, for the general community at large. You can search on the search bar, see what you are looking for, and I guarantee you there will be something available for you there. And then I also wanted to just quickly talk about some of the virtual programs that we are offering. Of course, right now we are going through a pretty difficult time in terms of not being able to meet in person and socialize in the ways that we have been used to. But I am so happy to say that the Alzheimer's Association has found a way to transition our in-person educational programs into a virtual manner. And the great thing about it is that the platform that we utilize also allows for interaction with the speakers as well as with each other, and you can ask questions as well. So even though we are doing it in a virtual manner, there's still that socialization aspect, which really is fantastic. So we have our virtual Brain Buzz and also our virtual Caregiver College, and each of these programs talk about the risk reduction aspects related to Alzheimer's and dementia. We discuss brain health as well as raising awareness about, in general, about Alzheimer's and dementia and why it is important for early detection. All of these programs, if you're looking for more information, you can go to our community resource finder, and that is communityresourcefinder.org, and you're able to find a schedule of what programs are available at what date. They're all usually Monday through Friday at around 1 p.m. So it's a pretty good time as well, and there is some flexibility in those programming. If you're not able to attend any of these programs, you can go online and go to our Training and Education Center, and that's training.alz.org. I'll go ahead and send these over to you, Will, so you have those available. But you're able to access these programs there as well. So they're not live, but they're still giving you that quality information. in the programs that you won't be able to attend in a live manner. So I just wanted to share that with you and hope that you join us. Now, if you're not aware, Alzheimer's is actually the 6th leading cause of death in the nation. So awareness is a big factor, and education plays a tremendous role.
So I don't want to get overly personal. Do you see like an even amount of caregivers versus affected who use your like sources? Or I'm trying to think of this question here. Like, I mean, like I told you, like, I remember my grandfather was diagnosed.
Sure.
We were definitely, we did a lot of research, but sometimes having like a professional that you can go to that has all this stuff for you, then you don't have to like, pick from all these other places is really helpful. And I know that we were unaware of the association when we started.
Right.
So, and I think there's this idea too that only old people or senior citizens can get this. And it can really affect anybody, right? Like, especially the early onset, you can be pretty young when you get it.
Yes, absolutely. So to just kind of address a few things there, as far as caregivers are concerned, there's actually usually there are more caregivers in Florida alone, but in the nation as well, than there are, individuals diagnosed with the disease. And there could be many reasons for that, but really the main thing is that when you have a loved one with an Alzheimer's or dementia diagnosis, you usually are composing a care team that is multiple caregivers that's providing care for that individual. So in Florida, there's about 520,000 individuals diagnosed with Alzheimer and over 1 million caregivers, just to kind of give you an overview on that. The other thing was about some of the resources for caregivers. There is quite specifically a lot of resources for caregivers online that can help navigate through the initial challenges with an Alzheimer's and dementia diagnosis. So, for example, legal and financial planning is usually one of the very first things that caregivers want to address, and there's some resources available online for that as well. And then, of course, with the early onset, you're absolutely correct. Although it is not as common, it is still possible for an individual to develop early onset Alzheimer's. And that's usually any time that an individual gets diagnosed before the age of 65, but there have been cases where someone gets diagnosed as early as their 30s. So it's not just, as you said, it's not just a senior citizen disease. It's not a normal part of aging.
Mm-hmm.
And it can definitely happen, when you least expect it to.
Right. So can you just very quickly name some of the actual programs so people know, like, okay, these are the topics that I can look for, that I can get some help with?
Sure. So let's start with some of the general ones that are great for anyone seeking to learn a little bit more, have a little bit more of an education around Alzheimer's and dementia. We do have one that's called Understanding Alzheimer's and Dementia. We have one on the 10 warning signs of Alzheimer's, and that tends to compare what some typical warning signs would be versus normal aging. And then we have also Healthy Living for the Brain and Body. These are tips from the latest research, and what this does is it shows 4 lifestyle categories, and how you can adjust those to reduce the risk of developing some kind of dementia in the future. Now, as far as more caregiver specific, we have Effective Communication Strategies, which is fantastic because it breaks down early stage, middle stage, and late stage communication and gives tips on how to address your loved one in each of these stages. And we also have Understanding and Responding to Dementia-Related Behaviors, which really talks about the behaviors, the common behaviors that an individual with dementia may experience and how you can respond to those appropriately. And then we also have our legal and financial planning available as topics as well.
Awesome. Thank you. Is there anything that we haven't covered you want to highlight that we think that the community should know? I mean, I think we did a good job overall. I really want our patrons to share this information so we have people taking you up on your resources, because, you know, having Alzheimer's in the family or dementia is stressful for everyone, even if they don't live with you. So,
Absolutely.
you know, like, I highly recommend people take these resources, especially just the communication. You know, nothing they say is personal, because it's not the person you remember necessarily. You know, the brain's completely.
100% true.
So,
Yes.
if is there anything we haven't covered that you want to highlight for our patrons out there?
Sure. So I think those are the main things that I want to cover. One of the things that we kind of just briefly discussed before this was the idea of just making individuals aware that there are resources available. And also that it's okay to reach out. You don't have to be by yourself if you're a caregiver. You don't have to feel like you have to do this by yourself. Between the Alzheimer's Association, your direct support team, the community around you, there is so many resources available that I would absolutely suggest for you to reach out to and seek that assistance. And then, of course, one more important point to mention for any caregivers, you have to also remember to take care of yourself. Your health is also a priority, and that's very important, especially during these difficult times with COVID-19. So as a caregiver, please remember that part. You have to be aware of your own health needs and personal needs and mental health needs as well. And then once that's addressed, then you're able to better care for your loved ones.
Thank you. And for patrons, if you have trouble remembering, you know, the websites, I'll have all the information. You know, the libraries can get you, you know, flyers if you need a piece of paper to help you remember. Because I know we all have 1,000 things going on at any one time. So I
Yes.
just want to thank you again. And as soon as, you know, you're able to and we're able to have in-person stuff again, whether it's the Brain Buster or an actual class, we will definitely, you know, do our best to bring it to a branch in the system at least.
Absolutely.
Yeah, and I can't, for our patrons out there, I can't highlight enough, like, if you know of anyone, if it's a neighbor, family member, please go to their website, take up them off on their classes. It is, unless you experience it, is very different type of disease you have to deal with. And it affects everyone in the community, like, you know, from the family unit to if you have close neighbors. So, you know, my grandparents, thankfully, they had good neighbors at the time. And so when my grandfather left the house, they knew to take him home so he wouldn't get lost. So, like, it is a community effort, and I just can't thank you enough for doing this. And
My pleasure. Thank you for giving me the
yeah,
opportunity. I'm glad that we were able to work together to just, show everyone that there's resources and there's support here for them.
thank you again.